Former spokesman on health, Dr. Morais, and he is also a five-term St. Mary Central Member of Parliament. He was dealt a massive final blow in the sectoral address. We'll continue by saying that he blasted the government for what he called their push on public relations versus tackling the real issues. The doctor concludes the Andrew Holness-led JLP has done an injustice to the country's health sector. After a solid 22 years of service to the Jamaican people as Member of Parliament for St. Mary Central, Dr. Morais opted to step aside from representational politics with daggers drawn. In what could be considered a parting blow, he gave a scathing review of the health sector under the governing Jamaica Labour Party, insisting they were more focused on optics than solutions.
The system stands at a crossroads, battered by neglect, inefficiency, waste, and lack of meaningful accountability. Despite the spirited defense given a week ago, the reality is that Jamaica's public health system is at a critical breakpoint. Equipment failures, industrial action at every level of staff, overcrowded, deteriorating facilities have become the daily reality for our people. Many Jamaicans visiting hospitals for needed or emergency care have spent days and weeks fighting to be accommodated with a bed.
The medical doctor says some were even forced to sleep on hospital floors awaiting care. He contends these issues were not unique to the COVID-19 pandemic period.
Neither are they limited to any particular institution, urban or rural, whether type A, B, or C. In all of them it exists. The government's focus on public relations, Chris, and optics, rather than the actual delivery of service, has pushed the sector to the brink of collapse. Each week, we see or hear of another grieving family, another life lost, another tragedy that could have been prevented. And you know, Mr. Speaker, with glee, the minister in berating the previous government handling of health pointed to a newspaper article of 2015 which mentioned, and I quote, doctors use plastic bags as aprons in operating theatres.
The former opposition health spokesman says those criticisms have since morphed into complaints about services being aborted in certain hospitals, some owing to mold infestation.
At least in 2015, patients were getting the much-needed surgery with the aprons from plastic bag. One cannot say the same for today. Mr. Speaker, this is not just a crisis of infrastructure, but a crisis of leadership and compassion. Madam Speaker, nothing highlights, this crisis more starkly than the recent procurement scandal involving the $31 million drill. The matter is before the court, so we're not going to go into specific details here. Suffice it to say, $31 million is money that could have been used to purchase a drill and life-saving medications, repair broken equipment, or hire much-needed staff. We must question the value for money proposition and assert only that accountability is needed in the system.
The MP went further, insisting the country demands answers.
Tell the people of Jamaica how their money is being spent, and those responsible must be held to account. This, Mr. Speaker, is not a time for excuses. This is a time for action. The government must act decisively to restore trust and ensure that every dollar spent on healthcare delivers real value for money to the people of Jamaica.